wanted to extend my thanks to Provincial Grandmaster Paul Norman for inviting me today, and very grateful for the support you've been giving to promote organ donation over the last few months. My name is Ishan Askar from NHS Blood and Transplant, so we're the organisation that look after the organ donor register in the UK. We're also responsible for allocating organs and facilitating donation directly with donor families. And we also look after blood donation in England and North Wales. So we have a wide remit, and of course we're dependent on voluntary donation, we're dependent on individuals, families, communities supporting both forms of donation, including bone marrow, which we also look after too. And it's without those voluntary donations we wouldn't be able to do our life-saving work. So the community support and support from organisations is vital. I was just going to talk specifically around organ donation and just to sort of set the scene really, just to show the challenge we're facing and hopefully what we're trying to do to remedy that. Just to kick off, just saying, today, tomorrow, the day after, and every day this year, in the UK, 3 people will die whilst they're waiting for a life-saving organ transplant. The only way to improve and save your life was to have a transplant. You're most likely to say yes. And 97% of us would accept a transplant if we needed one. But if we're not willing to donate our organs, and if our families are not prepared to allow for donation to take place, there can be no transplantation. We have over 20 million people who've joined the NHS organ donor register. They've recorded their willingness to be a donor after their death. And over 500,000 people in the UK die. And surveys show most people support organ donation. So the problem we have is, why is there actually a problem? Why is there a shortage? It's not actually easy to be an organ donor. You have to die in hospital, usually in intensive care. And last year, just over 5,500 people died in circumstances where they could have become an organ donor. About what you wanted to happen. Even if you joined the organ donor register, they may not be certain that you joined, they may not be sure that you wanted to be a donor. Perhaps you joined many years ago and you didn't actually tell them for fear of upsetting them. And now they have to make that decision for you. Every day, someone in this country who could be a donor dies, and their relatives, in the midst of grief, shock and distress, are asked to make that decision and asked to donate their loved one's organs to somebody they don't know. We need to get the family's consent because we need to talk about their medical history. We also need to talk about their social history. We need to be sure it's actually safe for those donors' organs to be transplanted into someone else. Imagine if that was you. What would you say? If you haven't talked about organ donation as a family, then it's quite likely you'd say no. You might think that's the safer option. You might come to regret that decision later. It would be so much easier if you knew what your relative wanted. If they wanted to be a donor, then you could be proud and take comfort and support their decision to become a life-saving donor. Family refusal rate in the UK is actually the highest in Europe. But what we need is a revolution in public behaviour to help stop the 3 people who die needlessly every day. We know that organ donation is a difficult subject to talk about. We're talking about issues such as death and the unknown, and people do have fears around these issues. Some of the things people tell us they worry about include, will the doctor caring for me try to save my life? Yes, absolutely. The staff looking after you won't consider donation until nothing more can be done for you. The transplant teams are not aware of any potential donor until the family has actually given consent. Will my body be treated with respect? Absolutely. Organ recovery is carried out like a surgical procedure. It's a normal operation. And 2 doctors will separately confirm death before it begins. The family can spend time with their loved one afterwards too. I don't want to tempt fate. I don't like the idea of somebody retrieving my organs. The reality is, you're more likely to need an organ transplant than actually becoming a donor. And our bodies, of course, after our death, do not remain intact. Surely I'm too old, I'm too unhealthy, I have health problems, you wouldn't want my organs. The average age of a donor in the UK is 51 years, and the oldest person who's become a solid organ donor was aged 85 years. People with brain cancers, diabetes have donated, alcoholics have donated their kidneys, and over 40% of lungs come from people who've actually smoked. Please don't rule yourself out. If you want to be a donor, we will try and make this happen for you. We also tend to think the only people that benefit from organ donation are the recipients themselves. But research shows that families find this beneficial too as well. We often don't hear what it means to families whose loved ones have become donors. So I wanted to read to you Sarah's words. Her son, George, became an organ donor. And he said to his mum, he couldn't understand why people wouldn't want to donate their organs. Sadly, George was knocked off his bicycle. He was 10 years old when he died. This is Sarah's words. People say we were brave to make the decision to donate George's organs. We weren't brave at all. We were grateful we were in a position where we could bring some joy out of our situation. There isn't a day that goes by when I think of my beautiful, clever, kind, loving son, but also the people he's helped. They bring me so much comfort and pride. My letters from the transplant coordinators and one from the recipient and his family are very treasured. I get them out from time to time to read. If anyone else ever finds themselves in a similar situation to us, I'd urge them to donate their loved one's organs. It's a decision, I'm sure, that will give them a great deal of comfort and one they'll never regret. We at NHSBT hope that everyone in the UK will be proud to donate their organs when and if they can. But we know this won't happen without some inspirational leadership. Earlier this year, Provincial Grandmaster Paul Norman gave his support for this province to run a campaign amongst members and families. These campaigns are really important to us as they encourage communities to discuss organ donation and prompt individuals to share their donation decision, whatever that may be. Other examples include the National Federation of Women's Institutes, who passed a resolution in June asking their members to make their wishes regarding organ donation known and ask their friends and families to do the same. They will be running a campaign this year across all their federations. So I've come here today to ask yourselves as Mark Master Masons to consider if you could, as an organisation, you could lead a national campaign. Specifically, we would ask you to discuss organ donation at every opportunity with your family, your friends and in your communities, so that no family is left to guess what their loved one wanted. We believe with your support we can make a real difference to the 7,000 people and their families who are waiting for the life-saving gift of an organ transplant. Thank you very much.